Welcome back. There's a new teaching tool at McGill's Faculty of Medicine.
It's a simulated apartment where students learn about home care.
Tanya Kriviak explains.
All right, so Mrs. Smith, now that we're home.
Mrs. Smith is pretending to be an 82-year-old patient who is back home 4 days after her hip replacement.
We're going to back up into the bed.
Occupational therapist student Jessica Conti is training on how best to help her.
Learn through doing, so that when we go out into our fieldwork placements, we feel more comfortable. How are you doing today?
This is the newly built simulation apartment. It's part of the Steinberg Center for Simulation and Interactive Learning within the McGill Faculty of Medicine.
Much more of healthcare is moving into the home. There's a concept called the hospital at home. So people can manage their own care, or clinicians can actually look after patients in their own home.
And then, oh, isn't that something?
Yeah.
Different scenarios with different actors are played out. The focus is always patient care.
Eye contact, empathy, understanding the patient's concerns. And our actors are so good at being able to provide that feedback.
Students learn through hands-on experience, observing, and by debriefing afterwards.
What we can teach in school is, this is what we do, these are all the options. Now real life is about what fits this patient.
Okay, so what if we take down some of the plates for you?
Megan Chung says she's learned a valuable lesson.
It reminds you to remain client-centered, to listen to what they have to say, hear their story, come into their lives and help them in the best way possible in the life that they're living.
But the space isn't only reserved for medical health professionals. The goal is to eventually allow real patients to use it too.
Let's take a patient who's just had a new diagnosis of kidney failure and they need to start dialysis. How do they do that? Let them experience what it's going to be like.
And a pilot project is in the works for the fall with a group called Caregiver Crosswalk on how to deal with loved ones diagnosed with Alzheimer's.
They would come here and they would be given really like an Alzheimer 101 course to understand what the disease is, how it will progress, how they need to prepare themselves. And then they would go into the simulation apartment and we would teach them how to keep their loved ones safe at home.
A new tool as close to reality as possible to help train all involved to care for patients in the comfort of their own homes. Tanya Kriviak, CTV News.